Good afternoon, everybody. This is Councillor Gurpreet Bangra. We're here to discuss the vaccines, and today we have Hari Sharma of the Hindu Society of Maidenhead, Chief Patron. Welcome, Hari. And we have Councillor Stuart Carroll, our Health Chief for the Royal Borough, who is also a lead member for Adult Social Care, Public Health, Mental Health, Children's Services and Schools. Welcome, Councillor Carroll.
Thank you very much.
So, Hari, if you'd like to ask Councillor Carroll questions regarding the vaccine, I'll leave it over to you. Thank you.
Okay, great. Thank you very much. Good afternoon, Councillor Bangra and also Councillor Carroll. So I think before I ask any question to, I think, lead member for health and also lead member for children services, Councillor Stuart Carroll. So why I'm here today, I think the reason, I think last year, since I think this pandemic started, BMA is always on the national headlines. I think I explained, because maybe I think because of the immunity, I think, or maybe something genetics, we had a heavy casualty of deaths. I think we got to take, I think, this vaccine very seriously. Ethnic minority are less likely to take vaccine. I think there is a myth. What I think there is a latest report from Royal Society of Public Health has suggested 57% of Black, Asian and ethnic minority group would be happy to have the coronavirus vaccine compared with 79% of white population. So there is, I think, a disparity by percentage. I think the people had some concern or maybe some suspicion or maybe fake news, a lot of WhatsApp messages around. So I think it is very, I think, helpful and very useful for all communities to take this message. I must thank you very much for Royal Borough and also Councillor Bangra and Councillor Carroll to come have a meeting with me today. I think three members of my family, let me start from myself. I think three members of my family work for NHS. So I think my wife and my elder son, Dr. Amit, and Dr. Radhana, my daughter-in-law. So they had vaccine. And my wife, being on the front line, key worker from hospital, she also had vaccine first dose. And second dose, she has to wait. And we didn't see any complication. We didn't see any, it's like normal flu jab. And it's very, to me, it looks very safe. We didn't get any side effect. Again, it's the body, I think it react differently to different people. It is a perfect opportunity for all of us. It's a hope for the life. I think we need to have vaccine when your turns come. COVID-19 vaccine, I think we all know, help to protect by creating an antibody response in your body without your having to sick with this virus. So vaccine once you have vaccine might prevent you from getting COVID-19, or if you get it, the vaccine prevent you from becoming seriously ill or developing serious complication. Data from medical science has shown that vaccine has an efficacy rate of more than 90%. And experts want to learn more about the protection that COVID-19 vaccine provides and how long the immunity lasts before changing safety recommendation. Even after, I urge all the communities to have your vaccine. Even after having vaccine, be complacent, follow government COVID-19 guidelines, hand, face, and space. It takes time. The immunity, I think, as it takes time to develop in your body. Please do not be complacent. Follow Royal Borough and government guidelines, hand, face, and space. Now, it's really been a privilege, I think, looking at a resident newsletter every week from the Royal Borough and your team, and from Councillor Carroll on Facebook. I think disseminating message to the community about relevance of this vaccine, and also what they are doing to protect vulnerable and all community in general. So my question to Councillor Carroll, how serious this problem is, the number-wise, I'm talking about the numbers. Yes, we know, I think we all are in tier 4, which is, I think, maximum alert. So I think comparing with neighboring local authorities, so how I think efficient are we to roll out vaccine in the Royal Borough?
Thank you very much, Harry, for your question, and I'll come to your question in a few moments, but I do just want to, in the first instance, thank you profusely and profoundly for your fantastic words there. We know leadership matters in all communities, and you're right to talk about all communities, and I think what you're providing with your words, your insights, and your understanding is tremendous leadership. You talked very, very sensibly there about how safe the vaccines are and how we must all get the vaccines when the NHS makes contact. And you've talked about 3 family members who are working in the NHS. And may I just take the opportunity to pass on my thanks to your 3 family members who are doing so much fantastic work for the NHS at a very, very difficult time. It's massively appreciated. And you talked there about how they've had the vaccine, had no side effects, no complications, no problems. And these are incredibly safe vaccines. They go through an extremely rigorous independent assessment from our independent regulator, the MHRA. And as you say, are highly, highly efficacious as well. So they also work, as you say, over 90%, if not higher. So big, big thanks to what you're doing in terms of communicating that very, very important message. In terms of your question, of course, all of us at the moment in lockdown, you're quite right. Prior to that, we were in that highest tier. We had seen cases sadly significantly increase. We have seen with the lockdown effect cases start to decline, but we know hospitals are still under significant pressure from people who sadly have had to go into hospital. We have seen deaths increase, and that's why it's so vitally important, as you correctly said, that we all continue to follow the guidance stringently. And thank you so much again for just making that point about hands, space, face, simple but critical public health protocols. And also, as you rightly said, Harry, even if you've been vaccinated, you need to keep following those social distancing requirements and that guidance. So the situation locally, like the rest of the country and indeed the rest of the world, remains critical. It's why we have to adhere to this guidance, because of the situation we're in, and because we need to protect the NHS and save lives. We also need to do the right thing here by NHS workers. You will know this better than most. You've got 3 of them in your family. The last thing they need is more cases being presented in hospital. And so we've all got to play our part to also protect the NHS, but protect people who are working tirelessly on the front line in excruciatingly difficult conditions. Locally, I just want to reassure you that our programme is going at huge speed, what I would call Usain Bolt pace. It is being rapidly rolled out. I'm getting constantly briefed by NHS colleagues on how the programme is being implemented. It's so far been very successful. We've got incredibly high pull-through rates, and our coverage rates are looking high. But we do need those people who have been contacted by the NHS to go and get your vaccine. As Harry's just said there, this is a safe vaccine, it's an efficacious vaccine, and we've all got to play our part. I can't say it any better than Harry's just said it there. He said it perfectly. This is about all communities. the only way we're going to get through this pandemic and out of this pandemic, in addition to stringently adhering to the guidance, is vaccination. Vaccination is our magic weapon to fight this virus back, and we all have to play our part. So I hope that answers your question, Hari, but I really do want to again thank you for your words, because I think the leadership from you here is tremendous.
Yeah, thank you very much. I think a very, satisfied response from you. I think thank you very much for your hard work as well. I think raising awareness among the communities and also updating all the time to the borough resident. May I ask you another question?
Of course you can.
Yeah, I think, yes, I think as government decided, I think by mid-February, the all 4 top priorities is going to be immunized or going to be vaccinated. I know, I think my son, I think, he got a GP in Vinrish. I think they are into 3rd priority. I think probably, end of, next week, they're going to move on to last stage, which is 4th priority. They are well ahead of national, rolling out vaccine. So in the Royal Borough, are we around the deadline, or are we ahead, or are we behind? I think any insight that would be really appreciated.
Absolutely. So the cohorts you're making reference to have been determined by a body called the Joint Committee on Vaccination and Immunisation, the JCVI. That's independent of government, so it's based on a purely scientific clinical public health view, which is quite right. And they prioritised those cohorts you've described, which are the cohorts which are effectively most at risk of immediate death or serious disease. And of course, it's quite right that as an ethical society, we focus in on those people most vulnerable, most at risk of this terribly sinister virus. The good news here in the Royal Borough is we are absolutely on track, and we are on target to get those initial groups vaccinated per that government target of mid-February. There's still a lot of work to be done, and I know my local NHS colleagues are by no means complacent. Rolling out a mass immunisation programme like this is incredibly complicated. It's incredibly difficult, but we have a tremendous local NHS, and we have tremendous support services around that NHS, which includes the local authority and also an army of volunteers. And I just want to pay tribute to every single person who is involved in this extraordinary immunisation campaign and rolling through the programme for all they're doing, because you are quite literally saving lives and helping us push this virus back. And in terms of the next cohorts, government is going to keep that under review as to who should be prioritised next in terms of the risk to that person or that cohort. But what is really pleasing is locally, we are so far what we call green on the dashboard. We use a RAG-rated system of red, amber, green, so a bit like a traffic light system. If you're red, you're behind. If you're amber, you're not quite where you want to be. If you're green, you are on target. And I would actually say, as we speak today, that is a very, very light and bright shade of green we're talking about there. So we're not just in the green category, we're solidly in that green category. But, and this is my message again, it is vital that when the NHS makes contact, you book your appointment and you go and get vaccinated at the earliest available opportunity. We can only hit that target with you. It requires the public to come forward and do exactly as Hari said earlier, to go and get vaccinated and to remember that it's safe, it's efficacious, and that this is the way we get through this pandemic. So that's my plea to people. The system's doing what it needs to do, but we do need you to keep responding, going to get your vaccine and spreading the positive message about how important that is.
Okay. Yeah, can I also share one of the, suspicious emails getting to your system or getting a resident. I personally had received an email about 10 days ago. So then I thought, my turn is not yet. So it looks like a suspicious email. And then I think I know my children, I think they are forward to my elder son, and he immediately texts me back that do not respond this email. It's a fake email. I think somebody is taking undue advantage of the situation. So are we, Royal Borough, aware of, I think residents are getting fake emails? If there are any fake email or suspicious or scam, so where to forward those emails? Yes, I got the sources. I send it to my son. They verified and it's a fake, and I immediately delete it. Is there any way that if a resident get any suspicious email, then they can forward or they can alert the authority?
That is an excellent question, Harry, and extremely topical. And thank you for bringing that question forward. It's a really, really important area you're highlighting. First and foremost, just let's be really clear that the NHS will contact you when it's your turn to get the COVID vaccine. That's the first thing to say. So we don't need people calling their surgery, phoning the NHS up. The NHS is extremely busy at the moment. It's under extreme pressure. So please wait until the NHS contacts you, because we need to allow our healthcare professionals, for example, Harry's wife, Harry's son, Harry's daughter-in-law, to be able to do their job. We cannot have these people having to answer calls when they're trying to save people's lives on the front line. What happens is when it's your turn, you'll be contacted by a letter, a text or an email with information on how you book your appointment. And you need to then follow that information. Of course, if you are struggling to understand that information, you can contact the NHS or contact someone who is trusted in your family network or your friendship circle to help you with that. But in terms of what Harry said there, it's really important to think about spotting the signs of a scam. And, it is absolutely disgraceful and lamentable that people are trying to push out these scams, but we all have to be aware. So the first thing is the COVID vaccine is free of charge. You will never, ever have to pay for the COVID-19 vaccine. So if you see an email, you get a call, you get a letter saying, we need your bank account or card details, your PIN, your password, copies of any personal information, for example, a driver's license, a passport, any bills or pay slips, that's a scam. You should know immediately something's wrong, something doesn't smell right. And absolutely discard that, don't interact with it. And if you think there is an issue and it is a scam, you can report that to the Action Fraud hotline, and I'll just give you the number, which is 0300 123 2040. What we'll do is when we post this out, Gurpreet and I will include this information so everybody can see it, and absolutely report that to the fraud helpline and report it to the police. We do need to help the police here and the Action Fraud team to clamp down on these disgraceful scams. So if you do receive something like that, of course, don't interact with it, ignore it, but then report it, because the more these scams are reported, the more we're going to catch the people who are doing it. And let's just remember why this is important. This isn't just about people being scammed, as horrific as that is. Someone being scammed may end up not getting their vaccine, and that could threaten their life. So this is extremely serious, and Harry is right to raise this. And please do look out for those signs, report it to the police and Action Fraud, and that will be the responsible thing to do. But a really excellent point you raised, Harry. Thank you for raising it.
Yeah, and also may I suggest, I think this fraud action line number should be included into next newsletter. I think we got around thousands of people registered with the council, and I do get a new letter every week. Jennifer Humphrey, she sent it to all residents. I think it would be very helpful if we can include this Action 4 number in the newsletter.
Absolutely, it's a great suggestion. We'll take that as an action, Gurpreet and I will ask our communications team in the Royal Borough to include that and make that as prominent as we possibly can across social media as well, so everybody is fully alerted.
Yeah. Right. Okay. Can I say something about Hindu Society of Maidenhead? I think we had on so every month they do. Once this message is completed, I will forward to all the members. I think we got about 120 members. So we got their email address, and we got their permission to send this recorded message. So I can assure you, I think the next meeting, which is next week, Sunday, the 7th of February. So they do online Zoom meeting first week of every month. So as soon as this message finalized, I assure you, I think I will forward to the committee, and they will forward to all their members to raise awareness. And if they have any concern, please do get in touch, either you or the relevant authorities. So I think with regard to volunteers, I think volunteers, I think is not an issue. I don't think so in the Royal Borough. You mentioned that we got more than enough volunteers. If some time, I think the volunteers come and go. If there is any necessity in future, or maybe I think a month or 2 months time, so I think Hindu Society is quite happy to volunteer. We got also at the moment COVID Marshal, the lady called Vinita. I think she is a COVID Marshal on behalf of Hindu community. And we are strictly following government guidelines. I think no household are allowed. Any members, they don't meet, only online Zoom meeting once a month. So which is, I think they're trying to protect everyone and keeping, I think, safe everyone. Unfortunately, we got, I think, a couple of members of society in hospital. I think they are having treatment, and finger crossed they'll come out as soon as I think their treatment finish. And I wish them, I think, all the luck, and I think good health, and hopefully I'll see you them on the Zoom meeting.
Just as a way of closing comment, Hari, may I just take the opportunity to thank you again for what you're doing and for joining this very important question and answer session. It's so important we get clear, accurate, quality information out there. And I'd just also like to take the opportunity to thank the Hindu Society for the tremendous work that's being done as just described there. I know the Society well, particularly through yourself, and it's a fantastic community-spirited organisation, and some of the activities you've just described there to keep people safe, to ensure people get the right information, is absolutely fantastic. And please do pass on my thanks directly to all of your fellow members. And of course, for those individuals who are currently in hospital, we wish them the very best. We send them all our prayers and very much hope they will recover. But thank you very much for joining, and back to Gurpreet to close us out.
Thank you very much. Thanks, Stuart.
Thank you, Stuart. And I'd like to also pass on my thanks to the Hindu Society of Maidenhead, and thank Mr Hari Sharma for joining us today with the excellent questions to our lead member. And I would like to mention as well that Hari is one of our former councillors, so it's very nice to have him on today. So thank you once again, Hari, and thank you to our lead member for health for the excellent responses. And the main message we have today is, as always, it's very important to get vaccinated. We've got to save lives. So please do have your vaccine when the call comes from the NHS. Thank you, both of you. Much appreciated. Thank you once again.
Yeah, thank you very much, Councillor Bhangra and Councillor Carroll. Thank you.
Thank you.